Hello everyone, welcome back to our class, and this is the last and final lesson we're going to discuss neurological and physiological disorders. I have researched about Joker's disease, and I have found two diseases or associated illness for the behavior of Joker. You can see in his behavior that he's like continuously laughing without any particular reason. So I am just curious myself, and I hope this is a nice starting discussion. In my research, I found out that there are two types of disease that can be associated to his behavior. First is the Creutzfeldt-Jacobs disease, or CJD. It is a rare neurodegenerative condition or disorder that has a severe effects on the brain. CJD gradually destroys brain cells, which cause tiny holes to form in the brain. People with CJD experiences difficulty controlling body movements that may change their gait and speech, and also can cause dementia. So you can see in his disease that there is an uncontrollable behavior of laughing or sometimes crying. No? Another is the pseudobulbar effect, or PBA. So I think this is more appropriate to his behavior. So the bulbar effect is a condition that's characterized by episodes of sudden, uncontrollable, and inappropriate laughing or crying. So the bulbar effect typically occurs in people with certain neurological conditions or injuries, which might affect the way the brain controls the emotions. Brain damage from a stroke, brain tumor, or head trauma can lead to PBA. And PPA can also happen along with such conditions like multiple sclerosis. Okay, so I hope you've learned something from that. Next is let's discuss about neuroplasticity and neurogenesis. So these two important concepts are quite important for us to understand how does our neurons can really recover, no, and to produce more neurons. I think most of you or some of you might be curious, no, if our brain and our nervous system can still produce neurons after birth or even when we reach a certain age. This is actually explained by the concept of neuroplasticity, wherein it refers to the brain's ability to modify, change, and adapt to both structure and function throughout life. And this is in response to our experiences. So, just a note to everyone, our brain is not fully developed until the age of 25 or so. Okay, through neuroplasticity, this allows the neurons or the nerve cells in the brain to compensate for injury and disease and to adjust their activities in response to new situations or to changes in the environment. This helps us adapt into the changing environment, helps us adjust our biological functioning, no? And so it will help us survive as well. Neurogenesis. This is the process by which neurons are formed in the brain. No? Neurogenesis is crucial when an embryo is developing but also continues in certain brain regions after birth and throughout our lifespan. There are instances, some people can still believe that after the age of 25, there is still neurogenesis that happens. No, but some people, they don't believe in that. The process of neurogenesis in the brain starts off by getting triggered by neurogenetic signals. This could arise from a number of factors such as stimulated activity in certain brain regions. This then helps to develop and stimulate neural stem cells. I think you're familiar with stem cells, no? Do you treatment sometimes for people who have diseases, who have cancer, no? So this is quite promising for the medical care. Let's discuss about the complications in the brain. Despite the significant protection that the skull bones, the cerebrospinal fluid, and the blood-brain barrier provide to the brain, can still, there can still be damage that can occur, no? Which can then lead to interruptions in the blood supply and from the blows of the head. The growth of tumors and the abnormal electrical activity of seizures can also interrupt the normal brain functioning. We have here some different types of neurological disorders. We have stroke, a type of brain damage caused by an interruption of the blood supply to the brain, no? So talagang abrupt ito, no? Mabilisan. Cerebral hemorrhage naman is a condition caused by the bleeding in the brain. We have also aneurysm, no? This is a balloon-like bulge in the wall of an artery. So biglang pumuputok, no? Yung part na to, yung artery na to sa brain. Kaya may term tayong cerebral aneurysm. Ischemia naman is a condition in which inadequate blood flow results in insufficient quantities of oxygen being delivered to the tissue. Okay, so those are some neurological disorders. Okay, what is a tumor? Tumor is an independent growth of tissue which lacks purpose. No, we have a term benign and malignant tumor. Yung malignant tumor is a type of abnormal cell growth, it lacks boundaries, and invades the surrounding tissue and is very likely to recur following surgical removal. Okay, we also have benign tumor. It is an abnormal cell growth that develops within its own membrane and it's likely to recur following surgery to remove it. Okay, so what are the treatments, no, for these types of diseases like tumor? Surgery and chemotherapy are the ones that is being recommended by doctors. The most common approach to brain tumors is surgical removal. In addition to surgery, or in cases in which a surgery is very risky or impossible, radiation of the tumor can be done. Now, in chemotherapy, in which chemicals that destroy tumor cells are applied via the bloodstream, has proven quite challenging for use with brain tumors because most chemotherapy agents do not cross the blood-brain barrier. So we can actually see this on chapter 4 of your book to learn more about chemotherapy. Okay, let's discuss about seizures and epilepsy. No? Seizures are uncontrollable electrical activity or disturbances in the brain that are correlated with changes in consciousness. No? There are instances in seizures, no, wherein the person has that electrical signal at nawawalan siya ng consciousness. Some also might fidget, some also might also na loses his consciousness, no, abruptly. And first, it starts in the vision. Biglang nagiging blurred out yung vision. Some people might see lines or or maybe blinking lights, no? Then the seizure will then occur towards the person. Seizures often occur as a result of brain injury. Sometimes it can be through genetics and through development of the person. Can sometimes happen because of withdrawal from drugs. But other seizures appear without an obvious cause. When patients experience repetitive, unprovoked seizures, they are diagnosed with epilepsy. So just to take note to everyone, seizures and epilepsy cannot always be similar, cannot always be synonymous. Now, you cannot tell that the person is epileptic. Again, it should be recurring for it to become or for it to be diagnosed as epilepsy. So we have some types of seizures. We have partial seizure, we have generalized seizure. Under the generalized seizures, we have partial seizures. No, we also have simple partial seizures, complex partial seizures, and let's discuss them during our sync classes. So I know this might be sound so technical, but I will really discuss this to you. So, a partial seizure is a seizure that has a clear area of origin or focus. So, there are certain parts of the brain, like frontal lobe, temporal lobe, back of the head, no? Yung cause talaga kung saan nanggagaling yung seizure na to. Generalized seizure naman are a type of seizure where it affects the brain symmetrically without a clear point of origin. So, walang klaro kung saan talaga galing. Saan part ng head siya galing. Some partial seizures are preceded by an aura or premonition of the impending seizure. So, it's like a fearful and scary, event, or point wherein the person feels that the seizure can occur at some time, no? Malapit na ang seizure. So in some cases, the aura involves sensory distortions, whereas in others, it is simply the sense that a seizure will occur soon. Some people can smell something weird, some people might see blinking lights, some people might see mga lines, no? Depende sa tao. Generalized seizures typically are not accompanied by an aura. Okay, so let's first discuss partial seizure. So again, two types siya. We have a generalized seizure and we have partial seizures. For partial seizures, it is further subdivided into two types. We have simple partial seizure and complex partial seizure. Okay, just in summary, a simple partial seizure cause movements or sensations appropriate to the location of the starting point. No, these seizures are not accompanied by changes in consciousness. So, hindi nawawala ng malay yung person. A complex partial seizure, okay, ito na yung nawawala ng malay yung person. It normally begins in the temporal lobes and are associated with alterations in consciousness. During the seizure, the patient is likely to be very confused and will often have no memory of the seizure. In some cases, the person has the sense that he or she is re-experiencing a past event. So sometimes may mga deja vu moments, no? Wherein the person sense that it already happened or occurred, no? In others, there is a sense that his or her environment is oddly unknown or foreign. May pagka quiet depersonalization or derealization. May pagka nawawala siya sa reality phase niya na, it really does happen, no? So, may mga ganong cases. May pagka-surreal moment. Okay, ayun. So, generalized seizure, though, again, symmetrically affect both sides of the brain and do not appear to have a focus point or clear point of origin. Generalized seizures affect to result from the activation of circuits connecting the thalamus with the cortex. Two types of major categories of generalized seizures are grand mal and petit mal seizures. Okay, yung grand mal, ito yung large. Yung petit mal naman, from the word petit means small, and mal means pain. So let's discuss them. Okay, so grand mal, these are referred to as tonic clonic seizures due to the alternating phases of activity that the person experiences. These violent seizures begin with a 10-second tonic phase characterized by loss of consciousness, cessation of breathing, and intense muscular contraction. Okay, so yung tonic phase is characterized by the loss of consciousness, cessation of breathing, and intense muscular contraction. The clonic phase, in which it lasts about 1 minute, no? The body here experiences violent rhythmic contractions that often result in broken bones or other physical injuries. So sometimes urination and defecation can occur during the tonic phase. Due to accompanying autonomic excitation, the person will sweat and salivate profusely. There are behaviors that can occur towards the person that he is not aware of, that it can happen to him, without his consciousness and without his awareness. Okay, so the cycle of tonic and tonic phase is followed by a period of coma, lasting about 5 minutes. The muscles here then relax, breathing resumes normally, but the person remains unconscious. Following the coma, the person may awaken or transition into sleep. Okay, let's have petit mal seizures. These are less violent than grand mal seizures. For about 10 seconds, the person loses consciousness, and motor movements are limited to blinking. Head turns and movements can also happen. These seizures are sometimes referred to as absent seizure because the person is unaware of his or her surroundings during the seizure. Okay, these are the summary, of the types of seizures. For partial seizures, we have simple partial and we have complex partial. You can see here the focal points being affected and the hemispheres being affected symmetrically. There are also major features of every type of seizure here. Please review this table. No? So there are also other types of seizures. We have Jacksonian seizure. Okay, and we have different terms that we need to understand. Let's discuss other neurological disorders, headaches and migraines. So headaches cause the pain in the head, face, or upper neck and can vary in frequency and intensity. So it's different from migraine. Migraine is a genetically related condition, but it's usually featuring a severe form of headache, nausea, and sensory distortions. So not all headaches are classified as migraines. These are the symptoms for a migraine. The pain usually on one side of your head, but often on both sides. Pain that throbs or pulses. So parang nagpapalpitate, no? Sensitivity to light, sound, and sometimes smell and touch. Also, nausea and vomiting. We have also cerebral aneurysm. This is a ballooning arising from a weakened area in the wall of a blood vessel in the brain. If the brain aneurysm expands and the blood vessel wall becomes too thin, The aneurysm will rupture and bleed into the space around the brain. Ischemic stroke. No, this occurs when the blood supply to part of the brain is interrupted or reduced, preventing the brain tissue from getting oxygen and nutrients. This is where the brain cells begin to die in minutes. The question here is, can ischemic stroke be cured? To cure an ischemic stroke, doctors must dissolve the blood clot through either drugs or surgery. Let's discuss meningitis encephalitis. Meningitis is an infection of the meninges, wherein the membranes that surround the brain and the spinal cord. No? The meninges are the layers, no, that protects the brain and the spinal cord. So, nangyayari dito, no, nagkakaroon ng infection sa meninges, na which affects the brain and your spinal cord. Encephalitis naman is an inflammation of the brain itself. Causes of encephalitis and meningitis include viruses, bacteria, fungus, and parasites. This happens when the brain will attack itself. No, there is an inflammation involved here, which will then caused by viruses, bacteria, no, and so much other external substances or organisms. No, multiple sclerosis is a disease that can affect your brain and spinal cord and can cause problems with vision, balance, no, and muscle control. This definitely affects your central nervous system. Okay, next we have amyotrophic lateral sclerosis or ALS. This is a progressive nervous system disease that affects your nerve cells in the brain and spinal cord, causing the loss of muscle control. Let's discuss about cerebral palsy or CP. CP is a group of disorders which affects the person's ability to move and remain balanced and posture. CP is the most common motor disability in childhood. Ito yung nagka-affect sa eye-to-hand coordination, no? Hindi masyado makagamit ng kamay, or they can affected yung kanilang mga motor movements. Okay, so cerebral means having to do with the brain, and palsy means weakness or problems using the muscles. No, they cannot use their muscles well. So this happens in birth. No? Next is Parkinson's disease. Parkinson's disease is a brain disorder that leads to shaking, stiffness, and difficulty with walking, balance, and coordination. Parkinson's disease or symptoms usually begins gradually and gets worse over time. So it's a progressive disease, no? So it cannot be reversed once it's already gone into that stage. So may mga different stages, no? As the disease progresses, people may have difficulty walking and talking. So, most common symptom dito is yung shaking, no? Ng mga kamay and fidgeting, no? Next is we have Huntington's disease. Huntington's disease is a rare inherited disease that causes the progressive breakdown or degeneration of nerve cells in the brain. Huntington's disease has a broad impact on the person's functional abilities and usually results in movement, thinking, and psychiatric disorders. So it's quite related to Parkinson's disease, no? Next is we have yung pseudobulbar effect or PBA. So I've discussed this kanina. No? It's a condition that characterized by the episodes of sudden, uncontrollable, and inappropriate laughing or crying. These are the symptoms elicited by Joker. This can be caused by brain damage from a stroke, brain tumor, or head trauma and can lead to PBA. Okay, I hope you've learned something for our discussion, and that's all. Don't worry, guys, we're going to discuss this comprehensively during our class. No? Thank you so much for listening and have a great day. See ya.